Hello, this is Dr. A with your Intro to U.S. Healthcare lesson. We're going to look at Chapter 6 of Niles' Basics of the U.S. Healthcare System, and that is on Inpatient and Outpatient Services. And we're going to start with inpatient services. So inpatient services are services that involve an overnight stay of a patient. If you don't stay overnight, it's not inpatient, it's considered outpatient, and that'll be in Part 3 of this lesson. Inpatient hospital services, as defined by Medicare, are when the patient is admitted to the hospital based on a doctor's order to treat an illness or injury. So might require surgery, might require some antibiotics or some other medications administered over a length of several days. This definition is central to Medicare's reimbursement process for an inpatient service. Historically, the U.S. healthcare industry was based on the provision of inpatient services provided by hospitals and then outpatient services provided by physicians. So, although their original focus was inpatient services, as a result of cost containment and consumer preferences, more outpatient services are now being offered by hospitals. So they're diversifying, if you will, to meet the needs and the wants of their consumers, which are patients. Over 5,000 years ago, Greek temples were the first type of hospital, with similar institutions in Egyptian, Hindu, and Roman cultures. So you went to the temple if you wanted healing. So let's talk a little bit about the hospital's evolution in the United States and even starting in Europe. So the precursors of hospitals were almshouses, or also known as poorhouses. They were developed in the 1820s to primarily serve the poor. And they may not have, houses or adequate places to stay and, the funds to receive care. And hospitals then provided food and shelter to the poor and, of course, then treated the ill. Pest houses were operated by local governments and were used to quarantine people who had contagious diseases such as cholera and to isolate them from the rest of the town or city. And the framework of these institutions set up the concept of the hospital, of going to some place to get care. Whereas if you look prior to that, doctors made house calls, and that's how you get care. So here is a photo of an old almshouse, and here is a painting about a pest house, so quarantine house. So you can see, government officials and soldiers and stuff, and then you can see people that are sick. They're the ones that are naked, or partly naked. Okay, so in 1789, the Public Hospital of Baltimore was established for the indigent, meaning for the poor. And in 1889, so that's 100 years later, it became Johns Hopkins Hospital, which exists today as one of the best hospitals in the world. The original building is still there, their original hospitals. But with standardized medical education, hospitals became more accepted across socioeconomic classes and then developed into the symbol of medicine. So they had some growing pains, because when they were first established, again, they were either for the poor or for quarantine. So they, really didn't have that image that they have now. And so here is a historical photo of Johns Hopkins. Of course, it is a much larger facility now, but that original building is still there. In the 1920s, because of the development of medical technological advances, increases in the quality of medical training, and some specialization, and the economic development of the U.S., the establishment of the hospitals became the symbol of the institutionalization of healthcare, meaning that now healthcare is identified with a location, with a building, with something, which for us is the hospitals, and also the acknowledgement of the medical profession as a powerful presence in our communities. And so some of the medical technological advances that we can think of are the beginning of x-rays and, lab testing. A little bit later on, we have blood transfusions and with blood typing compatibility testing. Of course, even nursing as a profession even predates that. Nurses are one of the first group that was organized as a profession. But anyway, so a lot of that made it where even doctors in practice became more specialized because of training, due to training, but also because of the need, because of the advances in medical technology. In 1973, the first Patient Bill of Rights was introduced to represent the healthcare consumer in hospital care, so the patient. And in 1972, so a year before that, the American Hospital Association had all hospitals display a Patient Bill of Rights in their institutions. Although hospitals are still an integral part of our healthcare delivery system, the method of their delivery of care has changed. And of course, now we also are going to contend with a lot of the outpatient services. So here is an example of the Patient's Bill of Rights. So some of the basic rights that you have are the right to information about your healthcare options, the right to make a decision regarding your healthcare, the right to transparency of medical quality and cost, the right to quality medical care, and the right to privacy and data confidentiality. So I think those are all kind of self-explanatory, but these are all rights that you have as a patient. So next in our hospital's evolution, hospitalist as a job was created in 1996. The hospitalists are providers who focus specifically on the care of patients when they are hospitalized. So a hospitalist does not have its own clinic or practice outside of the hospital. They come in and they clock in and they work usually a 12-hour shift, just like a lot of the nursing personnel does and other allied health personnel. And they take care of the patients that are in the hospital that are under their care for their shift, and then they hand over the care to the next hospitalist on duty. This new type of provider is there because they recognize the need of providing quality hospital care. Before that, what was happening is your family physician, your primary care provider, had to make rounds in the hospital for all of their patients and write orders and monitor their stay, etc., while also serving in their clinics and seeing their patient load. So a lot of times it would come either early in the morning before they had to be at that clinic, or they would come also maybe at lunchtime and then also at the end of the day. So that made some really long days for these primary care providers. And now with the advent of hospitalists, which again that really took off, and they can hand over the care of their patients to the hospitalist, who then reports back to them with a summary of the care the patient would receive while in the hospital, and the primary care physician does not have to make those visits to the hospitals. And so also more hospitals have recognized the trend of outpatient services and have integrated those types of services into their delivery as hospitals have evolved. There has been also a social cultural preference for outpatient care. People would rather sleep in their own bed and have their own food and family around them. They'd rather not have to stay in a hospital if they can help it. And also the technological advances have enabled more outpatient care. So minimally invasive surgeries is one of the technological advances that have made a lot of procedures that used to be inpatient procedures can now be done outpatient. Because of some of this, some hospitals have closed across the country. It is imperative that hospitals really manage their budgets and their costs really well, and sometimes it's difficult to do. Health systems have developed that include both inpatient and outpatient facilities, and so these are usually like hospitals with outpatient facilities that are linked to clinics and things like that, and they become, a big health system with a certain name or entity, and they have multiple locations, and they usually are over a certain region. So let's look at hospital types by ownership. So there are three major types of ownership. There's public, there's voluntary or community, and there's proprietary. Now, of the three, the voluntary or community is going to be the bulk of your hospital population, and public and proprietary have less. So let's look at them. Public hospitals are the oldest type of hospitals because they were initially, as if you think of pest houses and almshouses, were initially funded by the local governments or authorities. But now, so they are now currently owned either by the federal government, the state, or the local governments. In 2017, there were 972 state and local hospitals. A federal hospital generally do not serve the general public, but they operate for federal beneficiaries such as military personnel, veterans, and Native Americans. So I put the Department of Veterans Affairs symbol here because that's just one example of a federal hospital. You cannot get care there unless you are a veteran or you're listed as a beneficiary for these types of service. In the Indian Health Service, the same thing. You have to be part of a federally recognized tribe to get served at that type of hospital. In 2017, there were 208 federal hospitals. Now, there are a few state and locally owned. And in our area, we had one hospital that was initially owned by the county and eventually got sold, and became a voluntary or community hospital and was bought out by other entities. We still have one state hospital, and it's a psychiatric hospital. Voluntary hospital are privately owned, and they are non-profits. So this is a big thing. So non-profit, privately owned, so as in they don't have shareholders that they're trying to pay dividends to or make money for. They're considered voluntary because their financial support is a result of community organizational efforts. So it can be some fundraising, but also just the fact that the community uses these hospitals and therefore pays for services in these hospitals. Their focus is their community, so they're always doing outreach and things to improve health in the community. The private nonprofit hospitals are the largest group of hospitals. So most hospitals that you go to get care at, if you're an average person, is going to be a private nonprofit hospital. In 2017, there were over 2,968 nonprofit hospitals. Now, the last one is the proprietary or investor-owned hospitals, and these are for-profit institutions. They are owned by corporations, individuals, or partnerships. Their primary goal is to generate a profit. They have the lowest utilization rate, so most people don't like to associate healthcare with profits, but you can also think of clinics that do elective surgeries and plastic surgeries and those kinds of things. Those could be proprietary, investor-owned, and for-profit hospitals. In 2018, there were 1,322 proprietary hospitals. And that is the end of the lesson. I'm going to continue in part 2.